Well, let's go ahead and call this forum from Health Caucus together. The issue of what will happen at the state level as we watch the Affordable Care Act go through its implementation, and also we watch some of the challenges that are coming to the Affordable Care Act in the courts, leaves the states in a tough position. Uninsured adults are 3 times as likely as insured to have been unable to pay for their basic necessities, such as food and housing, due to medical bills. It is reasons such as these as we want to encourage the uninsured population to find affordable coverage. And here's the good news, and what we're going to hear today. It is there. It is available. It's a question of accessing it and a question of knowing where to go and who to ask. Joining us today are 2 experts on this issue who have looked into innovative ways that the states are helping their uninsured populations find affordable coverage. First, Mr. Phil Lebherz, known in the industry for being a passionate broker advocate, committed to reframing the issues affecting the brokerage community. In 2004, he founded the Foundation for Health Coverage Education, a nonprofit organization with the mission to simplify public and private health insurance eligibility in order to help more people access coverage. His input on the healthcare debate, the uninsured, and group health trends are featured regularly in numerous healthcare publications, including the Wall Street Journal, ABC News, the Washington Post, and CNN.
I'm here representing the Foundation for Health Coverage Education. We've put together a very high-tech, low-cost solution to the uninsured problems in the United States. The problem we saw is that a lot of the uninsured are eligible for programs and they're not aware. And so what we did is put the entire United States healthcare system online. Over 3 million Americans have used it. Through the power of technology, FHCE enables people who need health care obtain it. There's 16.9 million Americans who are eligible for publicly funded programs and not signed up. They're using the emergency room as their primary care. They go in the emergency room, they get taken care of, and then they leave. And the emergency room cannot collect because they're not there and they don't have the money to pay anyway. With a mission to provide simplified public and private health insurance eligibility information, the FHCE enables us as a nation to know and control our costs, prevent waste, fraud, and abuse, and allocate the total cost of health care properly and accurately. And we do this because we do eligibility at point of care. So when someone comes into the hospital, it takes 2 minutes. 2 minutes. The whole United States is online, all 50 states in the District of Columbia. The administrator asks the questions. They see what they're eligible for. It can be confirmed online, and then the hospital or doctor gets reimbursed. With point-of-care reimbursement and point-of-care eligibility, we empower the individual to understand that they have coverage if they're eligible. They no longer need to go to the emergency room for everything. All they simply need to do is show up at a doctor's office or a clinic. It takes 2 minutes to figure out. Once we collect all that data, for the very first time in American history, we're going to be able to budget our health care costs. And we'll lower immediately the uninsured by 17 million people. In California, Sharp Hospitals, that's 4 hospitals in San Diego with 4 emergency rooms, over a period of a year, asked 20,000 uninsured patients the eligibility quiz as they came in the emergency room. 80.2% were eligible for public programs and not signed up. So we called the Medicaid office in San Diego 50 times during working hours. After all, we're spending $3 billion a year in California. They answered the phone 15 times out of 50 times during working hours. 35 times you couldn't leave a message and they didn't answer. The 15 times that they did answer, you had an average time on hold of 22 minutes with the longest time on hold of 48 minutes. Our system's available on your iPhone. It's called Got Coverage. And it's all done anonymously. And there's no selling of anything. But all we want to do is make sure everybody understands what they're eligible for. Or your iPad, right? And so that's all on there. All you have to do is do that. It takes 2 minutes. It'll show you what you're eligible for. You know, it's simple.
Is this a problem for the states for the future? I mean, I understand it's going to be a problem because we've added so many newly eligible people on the Medicaid rolls, but you say they're not already they're not taking care of what they should be taking care of, and your point of service engine that will then drive people to the coverage that they actually should have. And then we're adding 15 million more people on the Medicaid rolls. It looks like a tremendous burden for the states.
Well, that's one way of looking at it. But if you think about it, it's a zero-sum game, because the 15 million people are already using the emergency room as their primary care, right? And they're not paying. And so we're paying anyway. We want all Americans to have health care access. If we have a program that is passed by law and that person's eligible, they should be able to use it. It shouldn't be sort of hide and seek. You know, let's make a law that makes us feel good, and then let's not let anybody use it. And we'll put a big, giant bureaucracy in the middle in order to sort of control what our budget is, right? We want to know exactly what it really is. We want to make it accountable, and then we can do cost containment, we can do waste, fraud, and abuse control, and we're going to provide access to all Americans for health care.